Welcome to this Youth Lives recording where we'll be talking with the Access to Mental Health Support for Young People in Schools research team as a part of the Youth Lives project about their proposal, which is what cultural barriers exist in accessing mental health services in schools and what are effective interventions to overcome them. So to introduce the topic and this work, this proposal was co-created by young people with lived experience of mental health aged 14 to 21 and mental health researchers and clinicians through the Youth Lives, which stands for Youth Lived Experience of Evidence Synthesis. Youth Lives was funded through the UKRI-funded Citizen Science Collaboration Award and ran from 2021 to 2024. The purpose of this proposal is to share the priorities and ideas of young people with the research community, with a hope that these ideas are taken forward and youth voices are embedded in future mental health research. Please feel free to use the ideas presented here to support future research bids. We would just ask that you let the Youth Lives team know and acknowledge the Youth Lives project in any bids and any papers published. Additionally, we would strongly recommend the use of participatory approaches with young people in future research inspired by these proposals. And we can share details of your project with the young people involved here in Youth Lives if you are interested in working with them. You can get in touch with the Youth Lives team by emailing youthlives-project@york.ac.uk. So now I'll ask the research team to talk about their proposal in more detail. So first of all, could you tell me what the background and significance of this research is?
Mental health support in schools is insufficient, especially for young people from minority cultural backgrounds who face additional barriers like stigma, cultural perceptions of mental health, and a lack of accessible services. Current interventions often overlook these cultural factors, leaving a gap in understanding and addressing the unique needs of these students. This research aims to fill that gap by investigating how cultural differences affect access to mental health support in schools. By co-designing solutions with young people, the project will support culturally tailored interventions to improve access and support for all students, especially those from underserved communities.
Thank you. And could you explain the vision for this project?
This multi-phase research project seeks to identify and address cultural barriers faced by young people to mental health support in UK schools. We recognise the heterogeneity in culture, religion, social context, and ethnicities. By co-designing surveys with youth researchers, conducting focus groups, and testing interventions, the study aims to provide culturally responsive solutions to improve mental health access and care in educational settings. The results will offer actionable recommendations for schools, policymakers, and mental health professionals.
Great, thank you. And could you explain what we already know about the literature and knowledge in this area?
We conducted a rapid scoping review to explore the extent of the research on cultural barriers to accessing mental health services in schools and interventions to overcome them. Due to the large amount of mental health in educational settings, we limited our review to systematic reviews and randomized control trials. We found 1,852 potential relevant records, which were reduced by title and abstract, followed by full-text screening to 264 relevant studies. The results were coded and placed into an evidence gap map, plotting the study focus against the outcomes. There were some clear patterns in the literature. Most studies looked at psychological or educational interventions and focused on adolescents rather than children. There was little evidence of variety in types of treatments outside of these categories. Depression and anxiety were the most researched areas, with very little research focusing on specific mental health disorders in schools. There was a large evidence gap in the mental health of ethnic minority groups or cultural barriers more generally, and only 8 studies explored access to services as an outcome.
And could you explain your proposed method for this research?
The proposed methods for this research have been co-written by youth researchers and mental health researchers. The research project aims to explore and address cultural barriers to mental health support in schools through three interconnected work packages. Work Package 1, co-design surveys and thematic analysis. Work Package 2, engagement through focus groups and other participatory approaches. Work Package 3, feasible study. Each WP will investigate key aspects of these barriers by employing mixed methods, including surveys, focus groups, and feasibility studies. The study will involve young people aged 5 to 21, school staff, and professionals working in education and youth spaces across the UK. Findings will contribute to academic policy and community discourse on culturally responsive mental health care in educational settings.
Work Package 1 is co-designed surveys and thematic analysis. Work Package 1 aims to collect data on religious and social barriers to support in schools through surveys, with the data analysed through thematic analysis. The survey questions will be co-designed by youth researchers with lived experience of mental health conditions. Survey will be sent to the following participants: schools, including SEND schools, reaching pupils aged 5 to 18. Youth and cultural centres around the UK. Participants recruited through faith networks, social media, schools, universities, and community organisations. School leavers aged 18 to 21. Participants for the survey will be recruited in the following ways: by engaging with faith networks, through social media, through schools, through universities, and through community gatekeeping organisations and community leaders. The survey will be customised for different groups. Young people will be asked about the mental health support they receive, while adults will focus on available provisions. The survey will address how cultural backgrounds impact mental health access and the types of mental health challenges requiring cultural consideration. Participants will receive a voucher for participation. The survey will seek to answer three key questions. What cultural barriers to mental health support exist in schools? Do these barriers vary across different cultural and ethnic groups? How do intersecting identities, for example, gender, religion, neurodiversity, influence access to mental health services? Thematic analysis will identify common barriers, enabling the team to compare responses across cultural groups. Findings will be shared via publications and a listening event for participants and stakeholders.
Work Package 2 aims to deepen the insights from Work Package 1 through focus groups and participatory methods with students and staff in various schools. Multiple focus groups will be conducted, separated by roles, students or staff. The discussions will explore trust in schools' mental health support, the impact of cultural factors, and different approaches by schools to address mental health challenges. Participatory activities such as debate-style questions and voting with feet will engage participants actively. The key questions we seek to answer are: do young people trust their schools and teachers to support their mental health? How do young people feel their needs are met by mental health support in schools? How do schools differ in addressing mental health barriers? What cultural considerations are vital for mental health services in schools? Analysis of these results will also look to see if there is bias in support towards certain groups of people and if/how their approach to mental health changes when speaking with them. Results will be disseminated through academic publications, a video highlighting key themes, and arts-based storytelling. A youth-led working group will analyse findings and co-produce recommendations for mental health interventions in schools.
Work Package 3 Feasibility Study. The aim of Work Package 3 is to test the feasibility of using known interventions in a school setting to improve the mental health support available for young people. Interventions with demonstrated success in non-profit and charity sectors will be identified and tested in school settings. The success of this intervention will be measured through evaluation with both young people and mental health professionals. These will be selected based on the findings from Work Package 1 and Work Package 2, particularly around the most pressing cultural barriers. Key questions this work package will answer are: which interventions from culturally sensitive mental health charities can be adapted for schools? How effective are these interventions in improving mental health support in educational environments? This study will determine the most suitable interventions for addressing cultural barriers in schools and provide guidelines for future practice.
Thank you. And now can you tell me more about how you will evaluate the impact of this project?
The impact of this project would be tangible, co-designed programs and interventions for improving mental health support in schools, creating in collaboration with young people. Increase access to mental health services in schools, particularly for students from culturally diverse backgrounds. Greater awareness among school staff and policymakers about cultural barriers and best practices for mental health support. We will measure this impact through several indicators, such as youth-led evaluations. In workshops, young people will define success measures such as A, the number of hours of mental health support accessed in schools, B, the quality of support received, whether issues were addressed, signposting occurred, and whether students felt confident in overcoming challenges. C. Emotional responses before, during, and after receiving support. 2. Implementation of recommendations. Schools adopting the co-designed interventions will be monitored for changes in mental health support availability and accessibility. Feedback from participants, surveys, and focus groups will gauge satisfaction with the support received and whether barriers have been reduced.
Thank you. And how will you communicate the findings of this research?
Once the research is complete, the findings will be shared with a range of stakeholders to ensure that the insights and recommendations lead to tangible change and raise awareness about cultural barriers to mental health support in schools. Key audiences will be schools and educators, policymakers and education authorities, mental health professionals and charities, academic community, young people and participants, and the broader public.
And what are the ethical considerations that you've made throughout this proposal?
Data will be treated carefully. For surveys, each participant will be assigned a number or initials and response anonymized to protect personal information. For focus groups, we will use dynamic consent so that people can choose if their input is anonymized or if they want their name attributed to their comments. Data will not be shared without participant consent. Participants can ask for their data to be removed at any time during the project and after the project's completion. Additionally, we may be interacting with young and vulnerable groups on a sensitive topic. We will ensure that people are supported whilst taking part, especially as some may have negative or upsetting experiences. To help mitigate this, we will give warnings at the beginning of the survey and sessions about what will be included.
Thank you. And finally, can you tell me about any risks that you've identified and how you plan to mitigate these?
The first risk we identified was people not finishing the survey, and we aim to mitigate this by keeping the survey short and having the option to skip questions. Our second risk identified was that people may not have the same meaning for questions, and this might be due to mental health literacy. And the way we'll mitigate this is by co-designing the questions with young people.
Thank you. And thank you to all of the research team for putting together their thoughts and perspectives on this proposal piece. I just want to say a few words about the capability of the team that have put together this proposal. So the team consists of Youth Lives participants, which are 10 youth co-researchers aged 15 to 23 years old at the start of the project in 2022 from a diverse range of backgrounds and demographics. Additionally, 3 mental health researchers worked with the youth co-researchers to co-produce this work, and 5 members of the core Youth Lives team who have experience across citizen science, mental health, and knowledge mobilization facilitated this process. Youth co-researchers and co-researchers have specific experience of psychology education and accessing mental health support in schools. Thank you so much for listening to this proposal. As a reminder, please feel free to use the ideas presented here to support future research bids. We would just ask that you let us know and that you acknowledge our projects in any bids and papers published. Please do look at using participatory approaches with young people in any research inspired by this work. And we are happy to send any details of proposed works or research projects to our young people if you would like to see if they'd like to be involved. You can get in touch with us by emailing youthlives-project@york.ac.uk or by visiting our website at www.sites.google.com/york.ac.uk/youthlives/home. Thank you for listening.